Good afternoon, everyone. We are admitting everyone from the waiting room. As we get situated, I'm just going to get an overview of the series and why we're here. While I'm doing that, if you could provide your name and affiliation in the chat, that would be greatly appreciated. It'll be used for attendance. While I'm talking about that, if you need a certificate of attendance, don't forget to type that into the chat either now or later. Before we finish, I'd be happy to send that. But in general, just to get started, so you are here for the Ability Grand Rounds, particularly the April series or April presentation for the Ability Grand Rounds series. This is sponsored by the West Virginia University Center for Excellence in Disabilities. We've had the privilege of providing this and meeting with one another on a national, international level for several years now, 3 or 4 years, and it's always delightful to hear what others are doing in the area of disability. So in general, we're going to talk about research, training, services that others are providing where they live. Our audiences differ. Who we're focusing on might be families, individuals, might be providers. That's the fun part about the series. Closed captioning is provided, so please request that using your menu options. If you need assistance with that, let me know. Provide that in chat. And then, like I said, certificates of attendance are available. While we go, we're all familiar with Zoom at this point, but just to be sure, we love questions. And Dr. Henning-Smith has said, provide questions either by chat as she goes. Until then, make sure that your line's muted. Sometimes we get noise, and so everyone can hear the presentation. That's very much appreciated. If you haven't already, put your name and affiliation in the chat. When you're comfortable, if you're comfortable, use your camera. We like to see you. It feels more of a connection, but we totally understand if you don't. And then at any point in time, like I said, chat, raise your hand, feel free to engage. I'm going to stop sharing. The only thing I'll say before introducing our speaker is that later on I will distribute an evaluation. And as always, we'd love to hear from you about how to make this a stronger opportunity, what you want to hear, how you want to set it up. Just please feel free to fill those out. Okay, so I'm excited to present our speaker for April. So Carrie Henning-Smith, Dr. Carrie Henning-Smith is an associate professor in the Division of Health Policy and Management at University of Minnesota, particularly the School of Public Health. She is the co-director of the University of Minnesota Rural Health Research Center and the co-director of the University of Minnesota's Rural Health Program. She is president-elect of the National Rural Health Association and serves on the board of directors for CentraCare, a large integrated health system serving central Minnesota. Dr. Henning-Smith has published more than 200 peer-reviewed manuscripts, commentaries, book chapters, and policy briefs, and her work has been widely cited in federal and state policy documents, as well as in national and international media outlets, including the New York Times, Washington Post, National Public Radio, NBC News, CBS, CNN, ProPublica, and Politico. Lastly, Dr. Henning-Smith's work focuses on rural health, very pertinent to us here in West Virginia, with particular attention to structural barriers to health and social well-being. She holds a BA in International Relations and Gender Studies from Claremont McKenna College, master's degrees in Public Health and Social Work, along with a certificate in Gerontology from the University of Michigan, and her doctorate is in Health Services Research with a minor in Demography from the University of Minnesota. So I am very excited to turn it over to Dr. Henning-Smith. And again, please feel free to use chat and let us know about your work.
Thanks, Leslie. I am delighted to be here with all of you. I was having fun reading your introductions in the chat, and I so admire the work that all of you do. I'm hoping that there's some useful nugget in what I'm going to talk about today. I want to give the caveat that I'm talking about housing for rural residents. I'm not going to talk very much specifically about disability, but I know I don't need to tell you that housing has really pronounced issues for folks with disabilities. All of the challenges that I'm going to be talking about are heightened in many ways in the work that all of you do. And rural residents have higher rates of disability. And so disability, even if I'm not talking directly about it, sits kind of squarely in the center of what we're focusing on today. And as Leslie said, I'm happy to be interrupted with questions. I probably won't be reading the chat as I go, but Leslie promised me she'd keep an eye on it. So if there's something that comes up there, I'm happy to address it. I'm going to start by acknowledging my collaborators, folks who have worked on this housing project with me for the past few years at the University of Minnesota Rural Health Research Center. This is really a team effort, and I'm going to be presenting work that all of these folks have done, and I've been able to work with them on this, but I cannot take sole credit for anything that I'm sharing today. Here's a roadmap for where we're going. I'm going to give you a little bit of background on the issue, and then I'm going to share some research results from quantitative work that we've done with several different large national data sources. Then I'll share some qualitative work we've done, results from key informant interviews, as well as case studies. I will end by sharing a summary of key findings and some policy implications from this work, and then hope that we have some time at the end for some good discussion. I would love to hear your insights. I know I have a lot to learn from all of you and the work that you do. So first, housing is really fundamentally important to our health. It is one of the core social drivers or social determinants of health. And there are many dimensions of housing. Instability is one dimension that we pay a lot of attention to. This is people being unhoused or having unstable housing. That can lead to poor physical and mental health outcomes. Safety and quality of one's home, even if someone is stably housed, having a poor home environment can lead to exposures to all sorts of toxins and negative exposures that we don't want people to have and that we know can be bad for health. And then affordability is another really important dimension. A lot of people need to pay too much to afford the houses that they live in, the apartments, the homes that they live in. And expensive housing costs mean that people are often making difficult choices between paying for housing or paying for medical care, medications, transportation, healthy food, and all of the other things that we need to live. You'll see me talk about each of these dimensions in different ways in the presentation today. So why talk about housing and health and rural? Why talk about this in a rural specific context? As my introduction implied, all of the work that I do is focused on rural health. Housing is not the singular focus of my work. I do work across a broad spectrum of rural health. But I think housing is really important in rural areas and takes on some unique challenges and dynamics. First, rural areas have older housing stock than urban areas, and that can lead to need for costly repairs. It can lead to things like lead paint or other toxins that have been regulated out of our systems but remain in many of the rural housing supply that we have. Air quality takes on a different dimension in rural areas, and that varies from region to region. Access to clean water, overcrowded housing, and access to care and services around people's homes. All of those dimensions look different in rural areas. And in some places, there are rural advantages. There are many rural places that have better air quality than urban places, but not all of them. All of these blend together to make it really important to understand the local, the geographic context in which one lives and accesses housing. And housing is one of those parts of our lives that has been highly regulated. There are a lot of policy actions at the federal, state, and local level that have gone into helping people, at least some people, afford housing and to regulate the quality of the homes that we live in, to regulate the way that we build houses, the way that we decide who can afford to live in them, where we locate affordable housing. just want to lift up a few housing programs and housing policies that have shaped the housing that we have today. All the way back almost 100 years ago, the National Housing Act made redlining legal, and that led to some of the racial segregation that we see even today, largely in urban areas that impacted rural areas less, but still has a lasting impact on our housing supply. In the 40s, the GI Bill opened up access to housing for lots and lots of veterans. However, not everyone was included in that. Black veterans were excluded from those benefits, and that has impacts on people's access to wealth and home equity even today. In the 50s, we had the Federal Highway Act that put in the highways and interstates that we know and use today, and that really fundamentally shaped the way that rural communities connect with urban communities and the rest of the places around them. The Federal Highway Act did a lot to connect us as a country, but did displace many low-income communities where the interstates went right through. And then more recently, I want to call out the Fair Housing Act and the introduction of Section 8 housing. Both of these tried to address housing affordability, but as you know, and as you likely see in your work, we have a long way to go to ensure that people still have access to accessible and affordable and high quality housing. So that's the end of talking about background. We could talk about housing and why it's important in the history of housing for hours. I'm not going to make you do that. I'm going to jump into talking about some of the research results here. First, I'm going to run you through some results from the National Health Interview Survey. This is the longest running national survey of our health, of the health of our country. It's been around since the 1950s. It's an annual survey that's conducted by the National Center for Health Statistics. And in this study, we used data from 2021, and we looked at adults who had complete information in the survey, had answered all the questions. That gave us just about 28,000 adults. And we looked at a couple of outcomes here. We looked to see whether there were rural-urban differences in residential stability, how often people were moving, how much people stayed within their same homes and communities. And we looked to see if there were rural-urban differences in the use of governmental rental assistance, some of those housing affordability programs that I mentioned earlier. First, for residential stability, as I mentioned this in the background, but I think it bears repeating. Being able to remain in your home and your community is really important for promoting social cohesion on a community level, for fostering that sense of place attachment and a sense of community. It's really important for relationship and helping people feel connected to their community, the people around them, and where they live. It's also really important for older adults to help them age in place and for people with disability. And there are certain barriers to people with functional limitations, mobility impairments that make it sometimes challenging to remain in the same home and to have that home be accessible and appropriate and useful for them in the way they need it to be. But if we can promote residential stability, it's helpful for promoting good health outcomes. But it's also possible that having long degrees of residential stability indicates that there are just fewer options for relocating, that someone might need accessible housing, they might need to downsize, they might really want a different type of housing arrangement within their community, but that isn't available to them or it's not affordable to them. So I don't want to say that it's all rosy and perfect. There are really two sides of the coin of residential stability. Here, what we're trying to see is just whether there are differences between rural and urban residents in how long they've been living in their current home. And you can see that among adults in the National Health Interview Survey, and this represents all adults in the country, there really are big differences. This probably isn't going to surprise any of you. I know that you know about rural areas, but rural adults in the sample were much more likely to say that they had lived in their same home for 20 years or more. More than a quarter of rural adults said that they lived in their same home for 20 years or more, compared with 1/5 of urban adults. Rural adults were also less likely to have moved within the last year, 10% versus 12%. This indicates that rural adults have more residential stability. This is, I think, in many ways a strength that we can build on, but we also need to make sure that this doesn't mean that people are stuck and that people have access to the accessible, affordable homes and services that they want and need. We also looked to see if there were differences among those people who said that they had lived in their homes for 20 years or more in their disability status, in their health status, and whether they had poor health and a disability. Rural is in the yellow lines, and you can see for each marker that we looked at, rural folks who had lived in their homes for more than 20 years reported higher rates of having a disability, higher rates of being in fair or poor health, and higher rates of being in fair or poor health and having a disability. A lot of these people in the sample, in among those people who had lived in their homes for 20 years or more, are older adults, but not all of them. This represents a spectrum of age and a spectrum of disability type and status. I know that these are really blunt measures here, and you're probably wondering to yourself and wanting more detail about type of disability or chronic conditions or other health indicators. This is what I have available to you today, but there are certainly more questions that can be asked with this survey. What this tells me, though, when we looked and see that more than 15% of rural residents who've been in their home for more than 20 years, and nearly 25% of those who've been in their home for 20 years say that they have fair or poor health, more than 15% say they have a disability. This tells me that there's a real opportunity to look at those folks who are remaining in their homes and ensuring that they're getting access to home modifications when necessary, to accessible services, build on that strength that they have of place attachment and community connection, but make sure that the home environment is still supportive and appropriate for them. Next, I said I was going to talk just briefly about receipt of governmental rental assistance. So whether people are getting help through Section 8 vouchers or other governmental rental assistance to afford the homes that they live in. This is specific to people who rent their homes. Many of the people in the last study that you saw in the residential stability study, a lot of those people who've been in their homes a long time own their homes, but not everyone owns their home. A lot of people rent. And we wanted to see whether there were rural and urban differences in the receipt of governmental rental assistance among those folks. And what we found is that among people who rented their homes, rural adults were much more likely to have received governmental rental assistance. It was about 13% of folks who rent in rural areas versus 8% of people who rent in urban areas. These results were published in the Journal of Rural Health. I'm happy to share this paper if anyone's interested in that. We did find, though, that rural adults were less likely to rent in the first place. Probably not a surprise, homeownership rates are higher in rural areas. But among those who rent, receipt of governmental rental assistance really plays an outsized role in rural areas. And so it indicates that those policies to support affordable housing in rural areas are particularly important for addressing the affordability issues that people encounter. Next, we used the American Community Survey to understand more about mobile and manufactured homes. This is a different dimension of housing. It probably feels to you like I'm skipping all around all different types of housing. There's just so much to say, so I'm cramming a lot into this 1 hour that we have together. But I think it does a disservice to talk about housing without talking about mobile and manufactured homes. When I say mobile and manufactured homes, these are largely known as mobile homes, but in the policy world and in regulations, these have been called manufactured homes for several decades now. It's talking about the same thing. Your double wides, your single wides that sit on a piece of land. For a lot of people, these can provide affordability and flexibility. These might be a really nice option. However, there is a growing body of literature showing that living in a mobile or manufactured home is associated with poorer health outcomes, including more respiratory health issues and more vulnerability to extreme weather and severe weather events. Living in a mobile home is also associated with financial vulnerability. It's the only type of housing that we have where the home loses value after it's purchased. Just about any other house you own, you increase equity, or that's can be for people a safe financial investment. That's not true for mobile homes. And often people may own the mobile home outright, but remain needing to pay rent on the land that they're on and don't have a lot of control over those rental prices. So while these offer the illusion of affordability, they can come with real financial costs. It's also worth mentioning that mobile and manufactured homes are not always accessible, but it's possible to modify them. And so I think that there are important dimensions here for disability, and maybe you see this in your work. I'd be interested to hear about that. For this analysis, to understand where people were living in mobile and manufactured homes, we used data from 2017 to 2021 from the American Community Survey. That data set is collected by the US Census Bureau. This shows a map of the United States. So you can zoom in a little bit on West Virginia and see that those rates are pretty high there and throughout the Southeast and parts of the Southwest. The darker the county, the higher the rates of people living in mobile homes. The lighter the county, the lower the rate of people living in mobile homes. And then this graph gets a little bit complicated, but I'm going to walk you through it. This graph is contrasting the poverty rate of the county and the percent of people living in mobile homes. The different colors of the dots are relate to rurality. So those that are red and purple are more urban counties. Those that are green and blue represent rural counties. The important thing to note on this graph, I'm not going to walk you through the whole thing, but the important thing to note is that poverty and the percent of people living in mobile homes are highly correlated. Not surprising, but we see that the higher the poverty rate in a county, the higher the rate of people living in mobile homes. And we also see that mobile home ownership is more common in rural places. Again, probably not a surprise, and there are different ways to look at this. We are working on publishing a brief on this right now, and so if this is really interesting to you, stay tuned, and hopefully that's published within the next few weeks. Next, I want to talk a little bit about housing quality and affordability. These are some of the other dimensions of housing that I mentioned. Oh, here we are using the American Community Survey again to try and understand how housing quality and affordability differ by rurality, as well as race and ethnicity and disability status. We looked at a number of outcomes, including housing cost burden. That is whether people pay more than 30% of their income toward housing. Crowded housing, that's whether or not there's more than two people living to a room. Incomplete kitchen and incomplete plumbing. I'm going to walk you through some more of the variables here, but in this one, we're using, again, data from the American Community Survey. It's a huge sample. We had more than 11 million, nearly 12 million respondents, and used survey weights to generate nationally representative estimates. We're looking at rural and urban location, race and ethnicity, and disability status using the definition that's used in the American Community Survey, which is a very broad definition, and ask people whether they have any difficulty with hearing, vision, cognitive ability, ambulatory ability, self-care, and activities of daily living, or difficulty living independently. For housing cost burden, this again is the percent of the household's monthly income that goes toward housing related costs. Being housing cost burden is a technical term that's used in policy and is used to understand where we need to address resources to deal with affordability issues. That's defined as spending more than 30% of your income on housing. And then there's a measure that's severe housing cost burden, and this is spending more than 50% of one's income toward housing. And it is should be just common sense here that if you're spending more than 50% of your income toward housing, that's going to mean really challenging choices around affording medicine and food and transportation and all of those other things that we need to get by from day to day. A little bit of a good news story here for rural, although not such a good news story for urban, is that we saw lower rates of housing cost burden and severe housing cost burden for rural residents. But still, a lot of people in rural and urban areas alike are dealing with housing affordability issues. More than 20% of all US residents have housing cost burden, paying more than 30% of their income, and approximately 10% are experiencing severe housing cost burden. We really have issues with housing affordability. This is breaking housing cost burden down by both rurality and disability. And what I want you to take away from this is that urban residents still are facing some of the highest housing costs, but that there is also a disability inequity here, that within rural areas and within urban areas, people with disability experience the highest rates of housing cost burden. In rural areas, nearly 30% of residents with a disability are experiencing housing cost burden, and nearly 15% are experiencing severe housing cost burden. So folks with disability are bearing the brunt of the housing affordability issue. For crowded housing, this is another measure that's used in policy and in research to understand housing quality. And it's defined typically as more than one person per bedroom. We made an exception for couples who were living together in a one-bedroom home or apartment, with the assumption that they only needed one bedroom. Of course, there are exceptions to that. And this is a measure that gets tricky because different people have different feelings about crowded housing. So you could say that there's some subjectivity here, but it's still a standard measure to understand just how much people are needing to share space within their home. This is a measure that's been used for many years, but became particularly salient during the pandemic when people needed to socially distance from one another, when someone might have been working in a meatpacking facility and then coming home and had been exposed to the virus, but was not able to distance from their household members. We saw COVID spread more quickly among people living in crowded housing. So I think it has real implications when we think about future emergencies, future pandemics, infectious disease spread. Here again, we found that rural residents experienced an advantage compared to urban residents. They're less likely to live in crowded housing. And we found some differences by race and ethnicity. For almost every racial and ethnic group, rural adults still experienced an advantage, with the exception of American Indian or Alaska Native rural residents, where crowded housing was more common among rural residents than it was among urban residents. And next, the next dimension of housing quality that I want to talk about is incomplete kitchen and plumbing. And these are measures that, again, are widely used in policy and to set regulations around housing. Incomplete kitchen means that someone lacks a stove or range, a refrigerator, or a sink with a faucet. Incomplete plumbing means that someone lacks hot and cold running water or a bathtub or shower within their housing unit. Here, we found rates were higher across the board for all of those measures among rural residents compared to urban. The rates were very low, though, across the board. Less than 1% of individuals reported that they lacked kitchen or plumbing facilities. But still, less than 1% of the US population adds up to a lot of people. When we totaled this up, we found that 368 100,000 rural residents and 1.5 million urban residents experience incomplete kitchen or plumbing facilities in their housing. And here are those comparisons when we add disability back in. And you can see that these disparities are even more pronounced. Again, the overall rates are fairly low. Most people have access to plumbing and kitchen facilities in their homes, but not everyone. And the people who are least likely to have kitchen and plumbing facilities are people with disability in both rural and urban locations. All of these results are published. I'm happy to share any of these. If there's anything here that's exciting or interesting to you, just let me know or let Leslie know, and I can get you access to all these briefs. These are the results by rurality and race and ethnicity. And the main takeaway point here is that the people most likely to have incomplete plumbing and kitchen by far are rural American Indian and Alaska Native individuals, where the rates were many times higher than they were compared to people in any other racial or ethnic group. If you're not sick yet of housing quality, I'm going to briefly run us through a few more measures of housing quality, and then I'll move on to the qualitative results, which I think are the most fun and most exciting part of what I'm going to be talking about today. But first, I'm going to share some results from the American Housing Survey. This is another survey that's administered by the U.S. Census Bureau. And this survey is really trying to better understand all of the specific details of the homes that we live in. It asks questions across a variety of domains, including about upkeep and maintenance of the home, heating and cooling of the home, plumbing of the home, and wiring and electrical function of the home. So I'll share some of those results with you here. This is data that we used from the 2019 American Housing Survey. At the time we conducted this study, that was the most recent year of data available. There is more recent data available now if you want to go in and look at it yourself. And we looked to see whether there were rural-urban differences in different domains across approximately 124 million housing units across the United States. Here's how those different domains were measured. Inadequate upkeep includes signs of mice or rats or other pests in the home within the last 12 months, open cracks or holes in the structure of the home from the outside to the inside, leakage from the outside structure, leakage of rainwater or other liquids or substances, and broken windows. Inadequate heating means that the individual lacked heating equipment in the last winter. I know that for folks here in Minnesota, that can be a fatal issue. And I imagine that that can be true in West Virginia too. I know it gets cold there sometimes also. Here's what we found. Almost across the board, we found that rural residents experienced more issues with housing quality in those two domains, upkeep and heating, compared with urban residents. What really stood out to us was the signs of mice or rats inside the home, where 20% of rural housing units were reporting some signs of those pests within the last 12 months. And there you can imagine lots of reasons for why this might be. And in many cases, this might not be all that big of a deal, and it might be something that's easily addressed. But it also could tie in with food safety and sanitary issues, and is something that's worth paying attention to, especially when we see a nearly twofold difference between rural and urban. We also saw that rural housing units had higher rates of broken windows, leakage from outside structures, and open cracks or holes into the interior. And then inadequate plumbing and wiring. Inadequate plumbing, asking people whether they lacked hot or cold piped water in the last 3 months and lacked a flush toilet in the last 3 months. These are similar to those measures from the census survey, but add a little more detail. And then inadequate wiring, asked whether housing units lacked electrical wiring at all or access to electricity within the home. Here we found now rural is in maroon here, and we found that rural was more likely to have all of these quality issues, although the rates were really very low, less than 0.5% for each of these measures. But there is a rural disparity here. Okay, I'm going to take a breath. Done with the quantitative work. So if you're not a data person, you are in the clear now, I promise. But I want to spend a few minutes talking about some interviews that we did where we talked with people from 27 different organizations that work in housing. These were organizations that worked on a national scope and thought about housing. Some of them had a specific focus on rural housing. Some were housing agencies more generally. These represented federal agencies and regulatory bodies focused on housing. These represented American or Administration for Community Living and folks who think about disability and aging and housing. These also represented large national nonprofits who focus on housing. When we talked with them, we asked them about barriers to housing in rural areas, how they're thinking about those barriers connected to health, and what they see as potential policy solutions. I don't have time to share everything that we found, but I am going to share just a few details of what we found in these interviews. And this has been published too in policy briefs. I'm happy to share that information if you'd like more detail. But when we asked people about barriers to housing in rural areas, not surprisingly, we heard a lot of issues. We heard that housing quality and safety was challenging, affordability, that there's simply not enough housing, there's not enough housing stock, that there are policy barriers or policies that are hampering new builds or modifications to homes, that there's housing instability, homelessness, being unhoused is an issue for rural residents. We heard a lot about infrastructure, both for housing, but also around transportation and supply chain and broader infrastructure that impacted housing. We heard about a lack of funding and resources at a local level to address housing issues and a lack of services, including development for rural areas to build houses or to modify houses, but also lack of services to support people living in rural homes in rural communities more broadly. I'm going to share just one quote to represent those barriers. We got lots of quotes here, but this is just one to illustrate some of what we heard. We do recognize that for patients and for care providers, housing is a really big issue, and we want to be able to do as much as we can. And some of those care providers wouldn't qualify for our direct housing funding because it's for very low income folks. If you're a doctor in a very small town, you probably aren't in the lower tier of income for that area, but that doesn't make that housing magically appear. That doesn't mean that that makes housing magically appear. So this was really about availability and availability for people across the income spectrum. Next, when we asked people the ways that they saw housing being connected with health and specifically for rural residents, they lifted up these 5 themes around cost of housing and making difficult choices between housing and medical care and medications, environmental and safety exposures, mental health and stress related to housing and inadequate housing, not enough housing for workforce. We have workforce shortages in many sectors in rural areas, and without the housing, it's hard to address workforce. And then access or distance of rural housing to services, including healthcare. Here's a quote to illustrate this. So when a home is not well maintained, it is not well insulated, well heated, well ventilated, where it has some type of damage, fire or water or infestation that hasn't been repaired, there can be a direct correlation between that and their resident. If the resident doesn't have the financial means to address those deficiencies and/or there isn't a local resource or labor pool, which is also a big challenge sometimes, then that housing just continues to become increasingly substandard. This is addressing a lot of different issues at once and issues that are particularly challenging in rural areas around the labor pool to address housing shortages and to address the need for housing maintenance and repair. And finally, we asked people what can be done. Where do they see hope? Where do they see promise in addressing housing? These won't come as a big surprise. These follow exactly from the challenges that they shared. But first and foremost, people said, we need money. There just aren't enough resources. We need money to address this. That's almost always the first policy implication that you hear. And I think that that will continue to be an issue. But people also said we need flexibility for grants or loans or housing programs. There needs to be flexibility to understand the rural context and the specific local challenges that each community faces. Regulations around housing might work in one community or in a big urban environment, and they won't work necessarily in all rural communities or local environments. They wanted to see policies that really supported and encouraged coordination and partnerships across sector. They wanted to see policies that continued to address infrastructure challenges to better connect rural communities and help them plug into supply chain and other infrastructure needed to address housing issues. They wanted to see incentives to make it more appealing for developers to want to be in the rural housing game. Zoning and codes around creative solutions like accessory dwelling units or allowing multifamily, multi-unit housing, even in some of our small rural communities or smaller rural cities where some creative zoning might help to address some of the issues that we're seeing. And finally, policies to incentivize services and providers to engage in rural housing. One quick quote from this domain, we heard the aging sector and the housing sector. There are partnerships, but there needs to be a lot more. And that's where I think a lot of innovation we see when states adopt policies and programs to really further those partnerships. That does so much to spur those connections at the community level where that really needs to happen. And finally, I'm rounding the bend here, and I'm looking forward to some time for discussion, but I want to just briefly mention that we've also published a series of case studies that's focused on housing for rural residents recovering from substance use disorders. This is a very specific population and a very specific housing need, and one that I imagine feels relevant in West Virginia, just as it does here in Minnesota. We talked with folks in 3 different programs, one in St. Peter, Minnesota, one in Pendleton, Oregon, that was part of the Yellowhawk Tribal Health Center, and one in Ravenswood, West Virginia. So I don't know if that's close to any of you, but we talked with Hope House Ministries in Ravenwood, West Virginia. Each of these shared with us some of the funding challenges and barriers that they had to get up and running, but also success stories about how they were able to organize and implement and sustain their housing model that they have for rural residents with substance use disorder in their community. There are certainly many, many other programs that are out there and doing incredible work, but we hope that these case studies offer some inspiration or some ideas for others in rural communities looking to implement similar programs. So finally, just to wrap up, some key findings from everything I shared today. There are really complex variations in housing quality and affordability at the intersections of race and ethnicity and disability status and rural and urban location. In some cases, rural residents are seeing an advantage when it comes to some measures of stability and affordability and housing quality. And in other cases, rural residents are seeing a disadvantage. We see variation by racial group. And when we looked at disability, we saw almost entirely more housing challenges for folks with disability in both rural and urban areas. Housing policies need to reflect the needs of housing quality among rural residents, as well as reflect both quality and accessibility needs for residents with disabilities in all locations. And I hope I convinced you that there are many dimensions of housing here. I think sometimes we focus just on the supply or just on affordability, and those are both important and necessary, but not sufficient on their own. We also need to focus on the quality of the existing housing that we have. We need to focus on ways to help people maintain their housing if that's what they want to do, to maintain that social cohesion and that community connection. There are many challenges here, many barriers, but that also gives us many places to start and many potential solutions and ideas that we can run with. Finally, a few additional policy implications. I mentioned this in many ways, but rural housing policy needs to be flexible and also tailored to the needs of those groups who are experiencing the greatest challenges, including people with disabilities. Policy improvements for housing can be flexible and can include people across agencies and sectors. All of you in your work have a role to play in this. People across agencies and sectors need to partner and collaborate to address all these issues. And improving housing quality is an important way to address population health and social drivers of health and promote health equity. So I am at the end of my formal presentation here. I would love to hear any questions or ideas, comments, critiques that you might have. And I really appreciate you bearing with me. That was a lot of me talking at you. So I hope you can share some thoughts with me now. Doug, I see your hand up.
Yeah, I just had a comment about so I'm from the assistive technology program here in West Virginia, and one of the
Yeah.
challenges we run into in the rural housing is the mobile homes. They can't hold power chairs, they can't hold lifts,
Yeah.
even their bathrooms aren't big enough for like transfer seats. So yeah, you put that on top of somebody with a disability not being able to get the equipment that would help them in recovery or just help them in their day to day. So it just adds more challenges through that. So that's often a question we have to ask when somebody's requesting a bigger piece of equipment from us is like, you can't, can your floors support this or can you get it through your door? Is your bathroom big enough for this piece? So yeah, I definitely appreciate the work and study.
Yeah, thank you so much. That's such an important dimension and one that we weren't able to look at with the data that we had, but it makes so much sense. And as you saw, West Virginia really lights up on that map. You have higher rates than the national average of people living in mobile homes. And I think the weight issue is not insignificant, and the quality issue too. It's really important for the work you do. Thank you.
The average cost for a mobile home in West Virginia now is about $98,000 for a single wide.
Hmm.
I just looked one up to see. A double wide right now is probably going to cost you about 150 to $200,000,
Mm,
and that's not on a block foundation. Once a modular hits a block foundation, it is considered a home.
yeah. Yeah.
When
Yeah,
I
I
ordered
just,
mine,
oh,
when I ordered mine, because I knew my grandmother was going to move in with me,
mhm.
I ordered extra wide door openings, and
Yeah,
yeah, I paid a premium for them.
yeah.
I ordered her a specific bathroom set up, so it was made for her, so I could get in there with her if she
Hmm.
needed assistance. Her bedroom doors were wider. It cost.
Oh, I bet. Yeah, that's not going to be affordable for a lot of people. Thank you, Pamela, for sharing those insights. It sounds like
My
you have a
my
lot of
my
forethought for
house
that.
payment was $850 a month,
Mm,
and then I went to a stick built house, and
uh-huh.
my payment dropped. It is $500 a month in a stick
Oh,
built.
wow. That's a big difference.
Yeah,
Wow.
it is. It's a lot of money.
Yeah. Thank you so much for sharing that. Todd, I see that you have your hand up.
Yes.
maybe. Yeah,
Oh.
there you are.
Yeah, you touched on it earlier, that I think you were getting at underwriting standards, typically percentage of your net disposable income,
Mhm.
automatically going towards either rent or housing cost. I worked on a project. I was city planner in Indianapolis for years, and
Okay.
I worked on a project, big housing project, and it was an aha moment for me, in terms of affordable housing and what it means to communities. And so it's a
Yeah.
comment, but so yeah, when you're 30 to 33% net disposable income automatically goes off, for housing, whether it's rental or a mortgage.
Mhm.
That leaves the 67% for other things. And it's that other things that really does more for a family or a household or an individual in terms of what their money can do. So that was really the sort of a Rubicon moment for me in housing. And it really lends to sort of the economic development aspect, and that housing is central, to getting communities healthy and allow communities to be able to support their families. So it's a huge thing. It's not so apparent when you're, doing it, but it's the other things, that the 67% that really is most meaningful.
Absolutely. Yeah. And if people don't have those choices, because they don't have the money that they can spend, that really hampers quality of life and health outcomes and everything else. Thank you for sharing that perspective, Todd. And thank you for mentioning city planners and economic developers. I think that they are critical to this conversation. And I should have lifted them up earlier, and I'm glad that you did. So thank you.
Thank you.
Deborah, I see your hand.
Hey there, thank you. So, staying on the topic of mobile homes, I'm wondering if other folks have heard about this. Um, I guess that in the state and possibly nationwide, you may have more information on this. Mobile homes were usually considered a pretty affordable option, but one of the
Mhm.
things that's changed is large corporations, nameless corporations, have taken over mobile home parks and just completely jacked up the lot rent to the point that it's no longer feasible for families, and it's like, now what? Like,
Yeah.
folks were already kind of at their um subsistence level in terms of what they could find and what they could afford, and now even that option has been priced out. And I'm wondering if that's something that's happened in other parts of the country as well. Happened to hear about this on a podcast. It was probably the Inside Appalachia podcast through West Virginia Public Broadcasting is probably where I heard that. And a friend of mine lives in Bluegrass Village, which is in Morgantown. It's a pretty nice neighborhood there. And that happened in her neighborhood too, was that they jacked up the cost of lot rents, and she's retired and she's really worried, what's going to happen. And she's a pretty healthy person who had a pretty reasonable job. And even she's concerned about what's going to happen. So I was just wondering if that's like a West Virginia thing, or if that's a national thing, or if there's anything we can do about that. Thanks.
Yeah. Oh, thank you, Deborah. I tried to allude to that earlier, but I think that you explained that much better and much more eloquently than I did. Yes, it's a national issue, and I think that there are really egregious cases out there. The ones that I've seen the most media attention to have been out of Florida, which is not to say that Florida is the worst offender, but I think that there are a few really egregious cases of corporate exploitation happening there, when it comes to land rents and lot prices. And it makes me angry, because I think that mobile homes, manufactured homes, have been marketed as an affordable option for people, but that doesn't account for the rent of the land. And if you are seeing that rent go up and you don't feel like you have a lot of control over it, it's just infuriating. I haven't seen a ton of policy action on that. Maybe others on the call know of things that are happening, but I think that there are options. There are ways for municipalities and state and federal government even to intervene here and to set some limits on, in particular, the amount that someone can raise the rent. I don't know that we can get to a place where we have rent control for lots, but I do think that we need some policy interference here so that people aren't taken advantage of. So I really appreciate you lifting that up. It's such a I think not widely visible aspect of life for people. And what I didn't show in this presentation, but I do show in that brief that I mentioned, is that about 12% of all rural residents live in mobile homes. So it's higher than that in West Virginia. You have a higher concentration. But across the country, we're not talking about a small group of people. More than 1 in 10 rural residents live in them. And so I wish that we had more policymakers paying attention to that, because it's a huge population, and I think there's huge potential for exploitation or taking advantage of people.
Thank you.
Yeah, thank you.
Carrie, I wonder, have you all ever had the opportunity to compare and maybe compare based on RUCA codes or some other geographic code, the databases that you've taken a look at with some disability databases to see if and how things might overlap, not only in the type of disability, but in some of these outcomes and experiences? I know that, for instance, CDC's community, I'm blanking on the name, it has some socio-demographic, but it also has a lot of elements about disability, and they are
Yeah.
by county. So that seems like a really interesting comparison there, if you had a chance.
Yeah. Not directly with the outcomes that I talked about today, but right now we are working on a different project that's separate from housing, that's doing some of what you're getting at. We're trying to understand how healthcare access and healthcare quality differs depending on the concentration of disability within a county. We haven't published anything on that yet. We're pretty early on in that project. But what I can say, from the preliminary results that we have, and this is probably not going to be a surprise to any of you, but the higher the rate of disability in a county, the poorer the healthcare quality, the less likely people are to be getting preventive services, preventive care, and the greater the healthcare access issues and the lower the health workforce. So, as it relates to healthcare, there's clearly a pattern by disability rate at the county level. I think there's a lot more that could be done there, though, and digging into specific disability type and how that intersects with poverty rates or other sociodemographic characteristics there. Lots of questions. So if there are any other researchers on the call today, maybe you can pick up and run with that. We certainly can't do all of that at our little center, but we try and do some of it. It's so important.
No, we appreciate your work. We appreciate you sharing your research. If you wouldn't mind sending the brief and the
Yeah.
previous articles, I think this group is interested in seeing those in more detail. when you-
Absolutely.
Or links to them. So how we could get to them is purely okay. And just thank you for your time. I've already put everything in there about the evaluation. And just to wrap up, again, you can put more questions in that evaluation because it's pertinent to our presentation today, but also send it to us directly, to myself directly, and I'll get it on to Carrie. But Carrie, thank you so much for sharing your work.
Thanks so much. Thanks to all of you for spending part of your afternoon with me. It was a great conversation.
We appreciated it. Take care, everyone. Have a nice afternoon.
Bye.